Welcome to the Behind Beliefs and Behaviors podcast, where we take you on a journey of what is behind the specific beliefs and behaviors that impact individuals and organizations. With our guests, we get to the root cause of what stands in the way of everything from health, wealth, and relationships to leadership, community transformation, and societal progress. From topics on leadership, psychological safety, corporate culture and communication, to parenting, trauma, relationships, personal health, and intimacy, this podcast is sure to get you to the source and provide you practical tips to transform your life one root cause at a time. I am your host, Dr. Maisha Claiborne. I'm a physician, a coach, a consultant, and an expert in trauma-informed communication. The founder of the Mind Remapping Company, I help individuals and organizations better understand the brain, behavior, and the root of false beliefs so that you can more effectively listen, communicate, connect, and create fulfilling relationships and results in your personal and professional life. Join us every Monday morning at 8 a.m. and let's get to the root cause and discover what's behind your beliefs and behaviors. Welcome back to another episode. I am super excited this episode. This is a conversation that I really haven't had before, and I love it because there's a relationship to intimacy. And if you've logged into this episode, you already know the title. Our relationship to intimacy can be very complicated. So I'm extremely excited to have this sister doc on with me, Dr. Sadaf Lodhi. She is an OBGYN. She's an intimacy coach, and she coaches around sexual health and menopause. And we are going to have what I think is going to be a very impactful conversation. And so, Dr. Lodhi, thank you so much for being on with me. How are you today?
I'm doing great. Thank you so much for having me on, Dr. Claiborne. I really appreciate it. Thank you.
Well, it is a pleasure, and I'm looking forward to the conversation. I really like for our guests to get to our listeners, rather, to get to know our guests and to get to know who they're listening to. So I'd love for you to share a little bit about who you are, how you came to specialize and become an expert in intimacy and sexual health and menopause.
Yeah, absolutely. So I am a board certified OBGYN practicing in New York. And what I realized was that our medical training, as well as my residency training, just really lacked in sexual health. As a gynecologist, most women will come to me if they're having any questions or concerns about vaginal dryness, pain with intercourse, menopause, or sexual health. And I realized that due to the lack of my own training, I didn't have the answers to provide them. So I went ahead and did a year-long course with the University of Michigan on sexual counseling and education. And then I also became an ISHWISH Fellow, which is the International Society for the Study of Women's Sexual Health. And so they do a lot of research-based focus on sexual health. And also they train physicians on how to deal with sexual dysfunction, like, for example, problems with orgasm, problems with arousal, problems with pain with intercourse, and all of those things. So all of those things that basically we didn't learn about.
Yeah.
That's what I went and learned about. And then also I became a Menopause Society certified practitioner so that I could also help my patients that are going through menopause, because as we don't learn very much at all about menopause, if we do learn it, I know that in residency, I didn't learn anything at all.
Yeah.
What's interesting is that we learned that different ethnicities go through perimenopause for different amounts of time. So really interesting, that might be perhaps interesting to your guests, and I know it's definitely interesting to my guests, is that African Americans tend to go through perimenopause approximately 10 years, where on average for white women, it's 7 years.
Wow.
And for Hispanic women, it's 8 to 9 years. And for Asian women from, let's say, like Japan or China, it's about 5 years. And they think for the Asian women, they think it might be due to diet because they eat a lot of soy. But for African American women and for Hispanic women, the thought is that they undergo what's called weathering. And for communities that have experienced generational trauma, it actually changes the DNA such that they exhibit problems such as high blood pressure, diabetes, and all of that, all of those things. And I know that, for example, Southeast Asians have the highest rate of cardiovascular disease
Yeah.
and also diabetes. And it's
Mhm.
not because of colonization that, and the fact that Southeast Asians were starved due to the colonizers, the British,
Mhm.
that
Yeah.
they developed these diseases. And so now it's
Yeah.
stuck with us through generations. And so the same thing for African American women that end up experiencing perimenopause for
Mhm.
about 10 years. And the same thought is that it's due to weathering.
Wow.
Yeah.
Thank you for that history lesson. And I did not know that. And
Yeah.
it's interesting because that there's this again, I do a lot of work in racial or anti-racism, health equity, and it's just like really like tinged my health equity receptors when you started talking. I was like, oh, there's some more conversations when I talk about psychological safety, when I talk about the impact
Yeah.
of trauma and
Yeah.
how that impacts our health and well-being. That's something as women
Yes.
that like I didn't know. And
Yeah.
so I appreciate you bringing that into the space.
Yep, yep. And the
Yeah.
reason why I bring that up is because oftentimes what happens is that when women are experiencing perimenopausal symptoms like the hot flushes, the night sweats, the mood
Yeah.
swings, the brain fog, the joint ache, and there's so many symptoms and they vary for so many women that women really need to advocate for themselves and that they really, because their practitioner may be like, oh, you're too young to be going through perimenopause. But
Mhm.
that's not the case. We know that the average age for somebody to go through menopause is 52, and
Mhm.
so if you imagine that an African woman goes through perimenopause for about 10 years, that could mean that she started perimenopause at the age of 42.
Yeah,
Right.
that's
So
so
she's
true.
having all of these symptoms and arrhythmia and like the heart palpitations, all of
Mhm.
those things. And they say that in perimenopause and in menopause, because there's so many estrogen receptors in the brain, in
Mhm.
our hypothalamus, in the amygdala, and
Mhm.
in, where we know like the pituitary
Yeah.
and the hippocampus, that because of all of those estrogen receptors and the decline of estrogen as we
Mhm.
go through perimenopause, we start to experience that brain fog, but also
Mhm. Yes.
anxiety, new onset depression, even if you've never
Mhm.
had depression before,
Mm.
because of the lack of estrogen. And so estrogen is almost seen as preventative.
Mhm.
So really important for women, whoever may be listening to this podcast, to really find a menopause practitioner that, one, will take the time to listen to you,
Yes.
two, believe you, and three,
Mhm.
treat you with what you
Mhm.
need, right? So that you
Mhm.
can function. We know that women lose so much time from work because of perimenopause and menopause. And really, this wasn't brought into light until the New York Times brought it up and wrote a whole
Yeah.
paper, the front page article on women have been lied to about menopause. And
Mm.
also then, I don't know if, but like Oprah had a whole segment on menopause, as well as Drew Barrymore. And so all of these people are starting to talk about it more, but before it really was not talked about. So super important for women to know the symptoms and then advocate for themselves.
That is very impactful to hear. And it's interesting because when I was in clinical medicine, now I'm family medicine is my specialty, but when I was practicing in my integrative medicine practice, I saw a lot of women come in who this was a while back before all of this research came up, who were starting to experience these symptoms early, even as early as like before 40,
Yep.
38,
Yep. And they're,
39.
yep,
And
mid
they were
30s. Yeah.
yeah, and then they were told by their OBGYN doctors, "Oh, no, there's no way you could be experiencing menopause." And so that was one of the things that women's health was one of the places where I leaned into even as a family practitioner. Now, my dad's a retired OBGYN doc, and I was like heavy when I was in residency into to women's health. So that was maternal and child health was like my love. So I have a special love and respect for my OBGYN docs because of that. But like what you're saying resonates because it was a lot of what I saw. Like the patient, the women would come in and they'd be younger in
Yes.
their late 30s, early 40s, starting to have sleep disturbances, starting to have brain fog and fatigue and mood swings,
Yes.
but they would still have regular
Yep.
periods. And so
Absolutely.
knowing the different hormones interact with each other, I was able to help them out. And
Yeah.
so I just appreciate now that you're bringing to light like this research, and also the disparities that happen between different cultures. I think that's extremely impactful as well.
Yeah.
What's interesting is we talk about this whole aspect of intimacy. I imagine that the intimacy gets very affected when make going through those changes as well. And I think we have a particular depth. The way we see, or the way people traditionally see intimacy, is one way. And I'd love for you to talk about and distinguish these different levels of intimacy, because I know that it's impacted in menopause. And when we lose, or when our sense of physical intimacy or ability to connect physically is altered, then it can be very disempowering. So let's talk a little bit about intimacy and distinguish that for our guests.
Absolutely. So, one of the things that you made mention and that I was actually remiss about not mentioning is the huge impact that sexual health really basically it takes a toll on when women go through perimenopause and menopause, because as we know, libido fluctuates. Sometimes you can have decreased libido. And also, one of the biggest symptoms of menopause and perimenopause is that women start to experience vaginal dryness
Yeah.
and pain with intercourse and irritation and burning. And then also they may have recurrent UTIs and experience issues with their bladder. And so all of those things, again, are due to the decrease in estrogen in our bodies. And so that's another reason why it's super important. And as women, I think we really take the blame for a lot of things, right? So, for example, if your relationship is not going well, women tend to automatically think that maybe perhaps there's something wrong with them, and that if they're not interested in sex, then again, there's something wrong with them. Or partners sometimes can make them feel that way as well, right? Or if they're not getting lubricated or whatever, they may say like, oh, perhaps their partner's not interested, or you're not interested in them. And all of those things really are the results of perimenopause and menopause. And again, it's really important to find a provider that can talk to you about it. But, as you mentioned, intimacy. So really intimacy is a connection, right? Whether it is physical, emotional, it could be spiritual, it could be any one of those, intellectual, experiential. And really, it's just a way to increase the bond between you and another person, right? So typically when we hear the word intimacy, we think automatically about sex. Like I just mentioned, there are other ways to increase intimacy. For example, with intellectual intimacy, you can basically communicate your likes, your wants, your desires, and connect through the exchange of ideas or discussion, right? Physical intimacy can just even be just holding hands or eye contact, touch. It could be any of those things, of course, intercourse as well. Emotional intimacy is really allowing yourself to be vulnerable with your partner, right? It's establishing trust in your relationship through honesty and sharing your innermost feelings and or forming a spiritual type of connection. And I think one of the easiest ways to create intimacy in a relationship, so say if you've been in this long-term relationship, and often people will say, well, how can I create this intimacy with my partner? We've been together for so long and everything is just like they're almost like a roommate, right? Like you see them and you're just passing by, but you don't really connect anymore, right? And one of the ways that you can do that is by just creating experiences together, right? It can just even be as simple as holding hands and taking a walk. It can be going for a walk outside. It can be having date nights. It can be doing activities and interests that both of you are really interested in. Maybe it's even creating a meal, right, together. Any of those things. It could be cuddling on the couch. It could be just sharing a moment, sharing a kiss, any of those things, right? So it doesn't really require lots of money. It doesn't require, a lot of time. It just requires you to be really intentional about the time that you spend together and really just being present in the moment without any judgment, right? That's what we talk about with being mindful, but really they say, and studies have shown that when you really just take the time to be in the moment,
Mhm.
That actually, so mindfulness actually increases arousal on libido and actually lubrication in
Mhm.
women when they take the time to be present in the moment. A lot of times when we're intimate with our partners, we're thinking about 50 other things, right? We're thinking about the laundry, the dishes, the kids, the homework, all of those things, right? And then you
Mhm.
wonder why you're not into it. Well, you're not into it because you're not really there. You're not present,
Mhm.
right? So one of the ways to be really present is to just focus on what you're doing. And there's something
Mhm.
that therapists, sex therapists call, which I love, is a modality called sensate focus. And what that is basically really tuning into the senses, right? So when you're intimate with your partner, feeling the texture, the touch, the pressure of, say, the hand or, whatever it is that you're doing, so that you're
Mhm.
really in tune to your senses so that you can be present, so you can
Yeah.
really enjoy what it is that you're doing, so that you're not trying to, solve the world's problems while you're being intimate with your partner, but instead you're just focusing on your partner and what's happening in that situation.
Yeah, I love that. I love all of that. What it brought up for me is this aspect of when we get disconnected, sometimes, again, we make ourselves wrong, but we don't often communicate also with our partners. And so I think that, and I'm going to shout out the men who may be listening. This is not just for women, this is for you because it's a way for you to understand
Yeah.
what's going on with your partner
Yeah.
and just even with the people in your life who are not men, right? And
Right.
so I think it's important, especially between partners, if we're talking about male female partner dynamic, I think it's important for women to communicate. And this doesn't exclude the female dynamic, but I think there is something nuanced about the male and female dynamic in communication or the lack thereof. And so I think that just in terms of understanding that you want to bring forth, like, this is what's happening for me. I want to feel close to you. And can we engage in activities that help me to feel close? That's how the physical is going to come. Like, my brain works differently from yours, my body works differently from yours. So, this is the way I would love to try. Would you try this with me? And I think that when we communicate this, and I think this works between any partnership, particularly, I know that there are sometimes the way men process it is a little bit different from the way women process. And so it's useful to be able to understand that and to connect and to explain in that way. And oftentimes it'll get their attention and be more willing. Now, sometimes it's opposite and the roles reversed, and the men need to come and say, "Hey, I want to feel close to you. I feel like you're not there." So sometimes the roles are reversed. And I just want to acknowledge and honor that. And by and large, my experience with coaching inside of that dynamic is that the communication, the open lines of communication need to be there so that each partner knows and understands, hey, this is what I need. This is what would work for me. Can we try this? Because I want to feel close to you. And if I feel close to you in this way, then it'll help me to be present and be close to you in this other way as well.
So, and I love the fact that you bring up communication, because actually, again, studies have shown that the biggest factor in any relationship that decides whether or not a woman is sexually satisfied is communication. That is the number one factor. So
Mhm.
it's really important for all of us to understand, but specifically women, that our partners can't read our minds, right? And
Mhm.
so we have to communicate what our likes are, what our wants are, what our desires are, so that they can, hopefully you can come to the middle ground, and then you can be satisfied in your relationship. It's interesting also that you mentioned that, the female male dynamic, and I agree with you 100%. And again,
Mhm.
communication comes into play, because there was, again, there's something called the orgasm gap. And what that means is that women in a heterosexual relationship tend to
Mhm.
orgasm 60% of the time, as opposed to men in a heterosexual relationship tend to orgasm in the night, like 90% of the time. And the reason why they find that is because one, partners are not familiar with each other's anatomy,
Yeah.
specifically men not knowing women's anatomy and how they orgasm, and the tendency to think that women orgasm through penetration, which we know is not true. It's through clitoral stimulation. And all of that just to say that there is a nuance in this male-female relationship, that it is different. And actually, you mentioned female relationship. And in a female relationship, there's actually women in that relationship tend to orgasm more. And again, it's because they understand how to help women orgasm. Whereas in a male-female relationship, that man in that relationship that partner may not understand the female anatomy and may not realize what it is that helps a woman achieve pleasure in that relationship. And unless that woman communicates, right, she's not going to find that pleasure in that relationship. So all of that together, just to say that different ways to communicate are really important, and to make sure that you communicate in your relationship so that you can experience pleasure in your relationship.
Yeah, it's interesting. As you were sharing, I was thinking how men, actually, I think in general, we are socialized not to talk about what pleasures us during
Yeah.
sexual encounters, during sexual intercourse and foreplay. And I know sometimes it's culturally, sometimes
Yes.
it's just from a gender or non-conforming
Yeah.
space. I love that you brought in the statistic that women, like female relationships, they tend to be higher levels of orgasm because they know the anatomy.
Yeah.
And I believe also more willing to communicate with
Yeah.
each other. It's like a safer space for
Yeah.
communication.
Yeah.
But we're socialized, males are socialized not to, well, we have to know and we can't ask.
Yeah.
And if we are guided, and this is what I've seen in some cases where if a female tries to guide a male during that process, the ego gets
Yeah.
wounded because
And
we're
also there's
social.
something wrong. Yeah.
Right, exactly. So it has to be something wrong. And because again, socialized that, oh, the male should know exactly what to do. But if we're not taught these things, I mean, certainly we're not, there's nothing like this in sex education. And I don't know about you, but I didn't get the talk growing up. I had
Nope.
to learn on
Nope.
my own.
Nope, exactly. And speaking of sex ed, that's a whole nother
Okay.
podcast. Sex ed is really dependent. I did actually a lecture on this too. Sex ed
Mhm.
is really dependent on your zip code.
Yes.
Right?
Oh,
And where you grow up, and whether or not, if it's like left leaning or right leaning, and
mhm,
whether your school focuses more on abstinence versus contraception versus pathologizing sex. There's
mhm.
never any talk about pleasure. It's
Correct.
always about like how to prevent pregnancy, domestic violence, and all of those things are super important.
Mhm,
It's really even more important to talk about pleasure and anatomy and really teach the proper terms for
mhm.
anatomy. I know that even as a gynecologist, everyone refers to the vulva as the vagina. It's awful, right? We don't even have the proper terminology. So
Correct.
I think, and of course, there's all this history as to why the
Mhm,
female genitalia is called the vagina, right? Because that's what brings men pleasure, not women. So we can get into
mhm.
that's like history there
Wow.
too. It's really important to know the anatomy. It's really important to communicate that with your partner, to let them know what pleasures you and how you can really take your physical intimacy to the next level, right? How
Mhm.
do you do that? And really, the way to do that is through communication.
Yes, absolutely. There's a word that came up in my mind as you were talking about you were like moving into the history of why the vagina is called the vagina. I was like, "Ooh, this is like sexual justice work," you know, in a way,
Yeah.
because I believe that for women, particularly, there's been power taken away, our empowerment around sexual health, sexual existence, and being sexual beings. And it's been weaponized against us, it's been shamed. And so that's the patriarchal aspect of this talk of this existence. And so
Absolutely.
I just appreciate mostly the education around it, but like the historical piece
Yeah.
and bringing this in, like, listen, we have been constrained inside of this conversation for far too long. And it's important to understand the history and reclaiming our ability to be sexual beings as women, as females, as however you identify in that capacity where power is taken away
Yeah.
is very important.
Yeah, absolutely. And we didn't even get into and touch upon growing up in a sex negative environment, right? Or having
Mhm,
experienced trauma. Like I know you focus
mhm.
a lot on trauma, but like sexual trauma and how that affects you and
Yeah,
how that affects you in a relationship and how do you move
yeah.
beyond that and how do you move beyond purity culture, right?
Oh
How do
gosh.
you, having grown up say in a sex negative environment and you're
Mhm,
told that sex is wrong, shameful, dirty, and
mhm,
then you grow up and all of a sudden now you're supposed to be the sexual being, but how do you
mhm,
go from sex negative to sex positive? I really think it's finding that neutral ground of just being, right? Like you don't
mhm,
have to go, if you've grown up your whole life in sex negativity, you don't have
mhm.
to all of a sudden do that 180, degree turn and become sex positive. You can just
Yeah.
become sex neutral and then maybe work your way towards sex positivity.
I think we have a whole podcast, a whole nother podcast on sex positivity versus sex negativity and how it comes to be and how we can begin to overcome that. I'm going to write that down.
Yeah,
You and I will be doing a part two for
absolutely.
sure, because I think that is so important,
Yeah.
especially when we're talking about this work of reproductive justice, of sexual justice. I'm calling it, I'm making that up. I don't know if it's actually a thing or not, but I'm
It
creating it
is.
as a
It
thing.
is. Reproductive justice is a thing,
Yeah.
absolutely. And gosh, I could go on and on, but we've created this environment here in the US where women have become reproductive refugees, right?
Oh, yes.
Where they have to go from state to
Mhm,
find access to abortion, where men, the
mhm,
Supreme Court is
mhm,
legislating whether a woman can have an abortion and each
mhm.
state, and then we have the abortion pill. And there's so much around. So yes, absolutely. Reproductive justice is a thing. And really, there's so much work, but that's beyond the
So
scope
much.
of this podcast right now.
Yes. Well, like I said, part 2 is coming for sure, for
Yeah,
sure.
yeah.
Well, I could go on and on. I wanna ask the question, I always like to ask my guests this question. Is there anything that we haven't just around this idea of what's behind our relationship to intimacy, of creating intimacy that we haven't talked about that you wanna share, you wanna leave our audience with?
I just think that what's really important to know is that it's never too late, right? It's never too late to increase the intimacy in a relationship if you put the time and effort into it. I know somebody once mentioned that the grass is always greener where you water it, and that's true, right? So
I
when
love
we
that.
take the time to really make the effort in our relationship to increase that intimacy in our relationship, it will grow and it will prosper with time. And really just simple things that you can do: hold hands, eye contact, touch, cuddling, kisses, simple things, nothing that requires a lot of time and money and effort. It's just simple things. But and also just being mindful, just being present, looking at the person when you're talking to them, right? Just turning your body around and facing your partner when you're talking to them shows them that you're really interested in what they have to say and that they matter to you. And I think putting away your phones is super important. And I also think that having date nights, and a lot of people think like, oh wow, that's so unromantic. But I would really counter that with saying, like, when you first met your partner, you scheduled everything, right? You scheduled a date. You thought about what you were gonna wear, how the night was gonna end, what you were gonna order for dinner, what perfume you were gonna put on, and things like that, right? And where you're gonna go and all of those things. So, and that you may have thought that perhaps that was spontaneous, but it really wasn't. It was scheduled. So bringing that onto as you get older and as we get into our long-term relationships, that is really critical. And just making time, even if it's like 5 minutes, and putting it into your calendar, right? To say that at, I don't know, at 9 o'clock when I'm ready and we don't have anything going on, everybody's tucked in and things like that, is I'm going to spend this 15 minutes with my partner just to ask them like how their day was and what was the best part about their day and how can I support you. And I think that's one of the best phrases, is how can I support you in what you're
Yes.
doing, because that shows the other person that you really care about them and you care about their well-being and you want to be there for them.
Absolutely. There's one thing that came up that I wanted to just share when you were talking about the date night, and I feel like the date actually begins when you schedule it
Yeah.
because of all the things that you said. it's the anticipation, it's the
Yeah,
build, it's the excitement, like,
yeah,
ooh, we got a date night coming up. So I just love that you said that.
yeah.
Oh, this has been such a wonderful conversation. I'm so excited. I really am excited for the part two. You've got me fired up here. And so I appreciate, Dr. Sadaf, that you have come on and engaged this conversation with me. And I would love for you to let people know how they can follow you if they are in the area, how they can come and work with you. Please give us your information.
Sure. So I am in New York and I'm in the process of opening up my private practice. So I focus on sexual and menopausal health. Yay. That's right. And I have a podcast myself. It's called the Muslim Sex Podcast, not just for Muslims. And Dr. Claiborne was on that as well. And we talk about all different topics relating to intimacy and health. And so I think that would be fantastic if your listeners wanted to also take a listen to that. And then also you can follow me on Instagram and TikTok at Dr. Sadaf OBGYN. I'm also on YouTube at Dr. Sadaf Intimacy Coach. And I have a website called drsadaf.com. I also have a retreat coming up in September. Yes, it focuses on basically menopausal and sexual health as well as nutrition as we age. And it will be in Morocco, September 16th through the 23rd. Yes, open to women and even couples. So you can even get a couples discount if you decide you want to attend. And that will be super exciting. And I think that's it.
That is cool. Well, so I want you to, listeners, go and visit Dr. Sadaf at her website. We're going to have all of the social media, all of the website, all of the information in the show notes. And when you have that link to register for the retreat, please give it to me. I'm going to add that to the show notes. If you already have it,
Absolutely.
give it to me now. We're going to put that in the show notes because this is such an important topic and an important issue. And I want the women who self-identify to come and create intimacy and with their partners or with themselves
Yes.
at your retreat. What you're doing is so important.
Thank you. And you know what? It's the best part about it. It's going to be in Morocco. So there are daily meditation and yoga and hammams and spa and excursions and almost all of the meals are included. I think there's like 3 dinners that are not. And then there's also going to be a barbecue on the beach and so many things. So really exciting.
This is exciting. Well, thank you again for coming on. I appreciate you. I look forward to our part 2.
Yes, absolutely. I do too.
Right.
Thank you so much for having me on. Thank you.
It's my pleasure. And to our listeners, I want to thank you all as well. Without the listeners, there is no podcast. Please share this episode. Share it with a friend, share it with a colleague, share it with a family member, because this really is an important topic. And we want to make sure people are experiencing transformation in their intimate relationships. And finally, remember to subscribe and leave a review. If you are getting value from these podcasts, we want our listeners to know that you are continuing to give value. And so please leave a review and mention Dr. Sadaf, her episode as well, so that people will zero in on that. So until our next episode, thank you all for listening. We will see you. And until then, you all stay empowered. Thank you for listening to our podcast. We know that without the listeners, there is no podcast. We hope you enjoyed this episode. Please remember to subscribe so you do not miss when we drop our next episode. And share this podcast with a friend, a family member, and a colleague, at least one person in your life today. This episode was brought to you by the Mind Remapping Company, helping organizations create psychologically and emotionally safe cultures that make their employees and leaders feel seen, heard, respected, welcome, and valued, all while fostering a thriving, engaged, and healthy workforce for the organization. Is your organization in need of a speaker? I speak about topics like psychological and emotional safety, trauma-informed communication, and employee well-being. If this is aligned with your organizational inclusion, belonging, or leadership goals, contact me, Dr. Maisha, by going to www.mindremappingacademy.com. mindremappingacademy.com. That's mindremappingacademy.com. Finally, we train leaders, but we also train coaches. If you're interested in becoming a trauma-informed coach, visit our website as well and check out our NLP coach trainings and certifications. We'll see you on the next episode. Until then, stay empowered.